Hello, friends. Welcome to our YouTube channel, SLP Sanjay Kumar, Voice Therapist. And with us, Navraz is here today after the voice therapy. And we did pre-therapy live on 15th of December. So, Navraz, how do you feel after the therapy?
Yes, sir. I feel very nice, sir. Very
Okay,
nice.
what exactly the problem was before the voice therapy?
So I had, sir, female type of voice, sir.
Mhm. So, because of your voice, what challenges you were facing earlier?
Before lots of challenges, sir.
Like?
Lots of challenges like I was not able to communicate with others. I used to feel shy.
Mm-hmm.
I didn't have any God
Mm-hmm.
confidence was zero.
Okay.
I was not able to speak in public or in crowd.
Yeah, so those who have joined our YouTube channel live, those who are watching, for them, I will be again introducing about myself also. My name is Sanjay Kumar. By profession, I'm a speech language pathologist and audiologist. And here is Navraz with us during the live session. And we have treated online to Navraz. And you can watch his before therapy live also. I'll be just playing that video. How was your voice before treatment? So I have that YouTube channel. I'll be just playing. This was your voice before therapy. I'm just going to play it here. And we did live on December 15th, before treatment live was. I'm playing your voice sample. Hello, friends. Welcome to our YouTube channel, SLP Sanjay Kumar, Voice Therapist. And we are live here. And with me, and Navraz is here. And Navraz is having some voice problem. His voice is like a childish voice and girlish voice, or we can say feminine voice. And today we are live before treatment, and today date is 15th of December 2020. So Navraj, say about your problem, why you contacted us.
I contacted her because of my family concern.
Mm-hmm. Yeah, tell in more details about yourself, your problem. Yeah.
My name is Chitri. I am 19 years old, and I am facing this problem from my puberty.
Okay. Tell your hobbies.
My hobby is to play games, play basketball, play online games, and read books.
Okay. And because of this problem, what challenges you are facing in your day-to-day life?
Speaking in communities,
Mm-hmm.
speaking with friends, communicating with solitude, and all.
Okay, so this was your before therapy life, and now, yeah, yeah. So Navraj, some people have joined newly. So again, tell, how do you feel after therapy? What are the reactions are coming when you are calling to your friends and relatives nowadays after treatment?
So after treatment, I feel very happy, and I feel like I am now my problem is solved. I feel like there's. I feel very happy, sir. Happiest moment of the life is today for me.
Okay. And thank you so much for your faith on us. And in spite of being so far distance, I'm in Bangalore and you are in different country, and you took online voice therapy from us. So, what was the reaction when you spoke to your friend first time after treatment? Was
First
he able
time,
to recognize?
no, sir. They weren't able to recognize me, sir. They were telling that it's your bro. They were saying
Okay.
me that they think that I was my small bro. Just a thing like that, sir.
Okay. And today I will be also speaking about little bit about communication disorder and the profession speech language pathology. So those who were watching, they can be connected with us. And in the last part of this live, last it will be about 30 minutes. So after 20-minute completion, I'll be discussing about question answer. So at this moment, we are going to talk about the communication disorder just for awareness, and the profession speech language pathology. How do you find that who are real speech therapists or who are fake speech therapists? Because many patients now, they're reaching to the some healthcare quacks, fake speech therapists, and they're spoiling their vocal cords and voice. So let's be connected. And so last 10 minutes, I'll be discussing question and answer. So let's talk about the communication disorder just a little bit. So at our center, we treat the voice problem, and we are more famous and more we have got recognition about the treating the voice disorder, like those who are having pitch and loudness problem, those who are having hoarse and breathy voice due to the vocal cord paralysis, and those who are having the fluency issue like stammering or stuttering. For that, we are providing speech therapy. But in the speech therapy field, there are so many things can be corrected, like those childrens or those who adults who are having the pronunciation problem. Like some people say for cat, they will be saying tat. We call it's a misarticulation, mispronunciation. This will be also can be corrected by the speech therapy. There are people, those who are having the problem in the fluency issue. Instead of saying the Kiran, they will say Kiran, something reaction. We call it a fluency issue, stammering or stuttering. For that, also speech therapy helps. And there are people due to the psychological reasons, sometimes this is little rare, they will completely lose the voice, there will be complete absence of voice, they will be communicating by writing and all. So by voice therapy we have seen a good change, and the people can watch in our playlist also, that is called functional aphonia. There can be children who will be speaking late speaker, like the child is age is 3 years but he is not making sentences, so we call it delayed speech and language. So speech therapy will be helpful in that situation also. Sometime I have seen that the when I was working in a pediatric hospital, the parents will bring the child at the age of 4 years, and I'll be asking why you are late, and child is not speaking a single words. So then they will be telling that my grandmother told like he will be speak after 4 year or 3 years. But it's very confusing. Sometimes they'll say some doctors told like that he will speak at 3 years, 4 years. It's a vague statement, because when you are telling he will speak, so what he will speak? Single word or phrases or sentences? It should be very clear, because at the age of 1 year, children will start speaking first meaningful word. At the age of 2 years, they will start combining two words, phrase level. At the age of 3 years, they will start speaking in sentences. So you can see the distance. From word to phrase, it takes 1 year. From phrase to sentence, it take again 1 year. So when you are telling your child will speak at the age of 3 years, so what he will speak, word or phrase or sentence, it should be very clear. Otherwise, there will be difficulty in diagnosing the communication disorder. And 2 to 5 years age is a very, very crucial age. During that time, myelination in brain happens, and the children learn very, very fast if you give the speech language therapy. So this is just for the awareness I wanted to share. I know that Navraj's problem is different. His problem was like a childish voice, or we can say feminine voice, girlish voice. And but just for the awareness, I was talking about some other communication disorder also. There are certain situations after the stroke, the patient will develop the aphasia, the language problem. So in that case also, we have seen the speech language therapy will be helpful. And because of the hearing impairment also, the some children will be delayed in speech language, and there will be some pronunciation problems. So when the child is coming, or when any adult is coming for the pronunciation issues, so we need to do the hearing evaluation also, because if a child will not hear properly, then how will we speak correctly? So the hearing evaluation is very, very important. So the my profession is, by profession I'm a speech language pathologist and audiologist. I have done my graduation from AIIMS Delhi, All Indian Institute of Medical Science, New Delhi, in the science, speech and hearing science. But post graduation I have done in the field of speech language pathology. So my area of interest is treating voice disorder. So that I was talking about a little bit of communication disorder. So Navraj, yeah, you can tell more about your problem and how do you feel? Maybe some new people have joined.
So before I was suffering from femalic voice, sir.
Mm-hmm.
So I had lots of challenges in my life.
Mm-hmm.
So when I used to speak, no one used to hear my voice because the pitch was very, very low. Same like small kindergarten kid.
Mm-hmm. So people were making fun of you because of the voice problem.
Not exactly fun, but they were saying that what happened to your voice? Suddenly you lost your voice, like that, sir. This kind of comments I used to get.
So sometimes your voice was not coming, and it was like a childish, also feminine, also all the kind of issues were there, and even the loudness was also the issue.
Sometimes, sir, I don't know, sir. It used to change automatically, sir. When teacher used to tell me to read, then
But
voice used
naturally, it was not coming like a more masculine kind of voice, is it?
never, sir. Naturally, female voice only, sir.
Only female voice. Okay, so tell your hobbies. I want people should hear your voice more and more.
So
And
I have
we have done the Navraz pre-therapy live on 15th of December 2020. And today is 25 December 2020. So people can watch, those who are watching this live, they can also watch Navraz pre-therapy live at our YouTube channel. Yeah, Navraz still.
I have lots of hobbies, sir.
Mm-hmm.
To play games, to play indoor games, online games, and also I love to do programming, learn about new things,
Mm-hmm.
explore, and I have lots of things, sir.
Mm-hmm.
I love to do bicycling, play cricket, tennis, and also.
Okay, fine. And so, what do you do now? You study, or you are what you do at this?
No, sir. This year I couldn't join college, sir. Next year I want to join college.
Okay,
Due
okay.
to COVID, sir.
Hmm.
I am done studying 12. I did last year, but done
So,
12.
what is your career plan?
Career means, sir.
Means what you want to become
Ambition,
after finishing your
ambition.
studies?
So I want to become what called businessman, sir. That's why
Okay.
I'm taking economics, sir.
Okay, I will just play your pre-therapy. Anyway, I have already played now, so no issues. Pre-live already in the beginning we have played, so people can watch. And just for awareness, I want to tell. Apart from correcting the pitch and loudness issue at our center, we also provide voice therapy for the people having hoarse and breathy voice due to the vocal cord paralysis, uh, pitch and loudness issue. Already we provide, and stammering, we call it the fluency issues, and suddenly voice has gone due to some psychological reason, we call it the functional aphonia. For that also we provide the speech therapy. And yeah, for no, I think I am getting one question. Niger Janmat, amazing work, sir. Are all the treatment done online? How effective is online speech therapy compared to face-to-face therapy? Is the same? What if online treatment doesn't work on the patients? Yes, for Navraz, the guy who is live here, we have all the session we have given online therapy only. And in fact, he's in different country, and I'm in Bangalore. So it was all by online, and there are you can explore our YouTube channel, Nigar. Uh, there we have made a separate list of online treated patients, and of course we provide both the kind of services, online and offline. So before starting online therapy, we do perceptual evaluation, and if needed we suggest some test also, and based on that our perceptual evaluation we decide who is the client for the online therapy. Of course online therapy doesn't work for all the patients, so after the perceptual evaluation only we suggest them online or offline. And if online therapy doesn't work, of course, you can come to our center. But before this, going for the online therapy session, we do the rigorous evaluation to check if you are a right candidate for online therapy or not. And thank you, Niger Janmat, for your question. Really, it was a very good question. And what kind of services we provide online or offline? Those who are watching, I'll be suggesting you can go to our YouTube channel playlist and explore all the different playlists, so you'll get an idea. Like you will find a different playlist for the communication disorder like stammering, you will find a different playlist for the vocal cord paralysis, functional aphonia, and even you'll find a spasmodic dysphonia playlist, you'll find the phonatory gap playlist, you'll find the puberphonia playlist, and you will find, yeah, so all the different kind of playlists, so you can explore, you'll get an idea how a expert in speech language pathology, how a speech language pathologist who is expert in treating voice disorder can change the people's life. And when I'm talking about the speech therapy and speech therapist, so there are a few things everybody should know that nowadays the social media is very common, and it has given big platform to everybody. So there are some healthcare quacks, fake speech therapists. They are using this platform, and they will be write about themselves. They are also a speech therapist, voice therapist, something like that at the social media pages. So before joining any center, before contacting any speech therapist, there are few things you should find out. What is the name of your speech therapist, and what is the name of the speech therapy center, where your speech therapist has studied, in which year he has done the graduation, post graduation, in which what are, in what area, in the speech language pathology area, or it's something different area, or if he is registered in the Rehabilitation Council of India or not. And if he has registered, if you have a doubt, you can ask the registration number. So if you'll go all the details, if the fake speech therapist will there, they will never inform all this kind of things. Like they will never mention the college, they will never mention what degree they have, they will never mention in which year they have studied, did their graduation in the post graduation, they will never mention what registration number they have in the Rehabilitation Council of India. So you can find, and if you're going to a very good reputed hospital or very reputed clinic, so the speech therapist will get the job after the verifying all the information, so there's nothing to worry. But if you are having the doubt, you can just inquire about your speech therapist, so that you can save your voice and the vocal cord. Because many times I have seen that in the, like those people has tried self-treatment, especially for the voice disorder, or taken treatment from the healthcare quacks, those who are fake speech therapists, fake voice therapists. They sometimes damage the vocal cord and the voice, and at that time I have seen that I was not able to help some cases. So it's better to take the help of the professionals. And so this is the way how you can identify. So what degree they will be having in the speech language pathology? So they will be having like I have B.Sc honors speech and hearing. So there may be the BA SLP or B.Sc speech and hearing, or B.Sc honors speech and hearing. That is the entry level, the basic level. And in India, people can walk after the graduation, but in the US, like countries, you should have the post graduation degree to have a license to work. So if you are able to find the post graduation, that is also good. If not, then at least graduation level degree should have. And and those who are having the diploma in this field, they are just assistant, not like a professional speech language pathologist and speech therapist. So and the bachelor degree is 4 years, and the master degree is 2 years. So after 6 years of studies, a good speech therapist you can be in India especially. And you must inquire the degree of your therapist. Otherwise, again, there can be the, after the wrong vocal exercise, if some quack is suggesting, if you do, the phonatory gap will develop, muscle tension dysphonia will develop, vocal nodule will develop, sometime vocal polyp may be developed due to the vocal abuse. So always take the help of the professionals. That is my suggestion. And a speech therapist, speech language pathologists are the professional. They help you to treat the communication disorder. If you have any communication disorder like voice problem, some functional voice problem, they will be easily treating very easily. But if there is an organic problem like a vocal nodule, vocal polyp, cyst, so they will work in the team with the ENT doctor. But if the problem is functional, alone they can treat sometime during the treatment. But sometime for the evaluation, we need the help of ENT doctor for the test called laryngoscopy. And never go for the surgery to a speech language pathologist if any communication disorder is there. And don't go any healthcare professional for the voice therapy other than the speech language pathologist, because speech language pathologists are the trained professional to give the voice therapy. Because of some unemployment and all, there are some other people also, they start all this kind of activity. So if I have a problem in my teeth, I'll go to the dentist, not for the cardiologist. If I have problem in my heart, so I'll be going to the cardiologist, not to the some orthopedician. So if you have a problem in the communication, so better to contact a speech language pathologist. So this information will be helping where to go, because many people don't know where to go when they have the problem. And yeah, and let's talk about the normal speech production mechanism also, so that we can correlate with the normal speech production mechanism and the communication problem. Many times I tell, but sometimes there will be new people, so awareness I'll be explaining. For the normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put a air pressure below the vocal cord. Here we have larynx. What I'm touching, it's called thyroid notch. Okay, it's a kind of cartilage. So inside the larynx, there is two string-like structures known as vocal cords. So once you breathe out, once you put air pressure below the vocal cord, vocal cords start moving like a string of a violin and guitar, and sounds will generate. Then we modify that sound into different sound with the help of our lips, tongue, jaw, teeth, palate. For example, if you want to say p, both the lips are coming closer together and touching each other. When you want to say t, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated and touching the soft palate. When you want to say t, so our tongue, tip of the tongue is coming behind the upper teeth, alveolar region. So each and every sound has its own place, own manner of articulation. If place will be wrong, manner will be wrong. So there will be some pronunciation problem. We call it the misarticulation, mispronunciation. Hindi में उच्चारण दोष. And like I was telling, how the speech production mechanism. First thing is the thoughts, then we take breath, then we put air pressure below the vocal cords move, sound generate. We modify that sound into different sound with the help of our like articulators like lips, tongue, jaw, teeth, palate. And when we speak a one sentence, in one sentence there are so many words. In each word there are so many sound. Each sound has own place, own manner of articulation. So it's quite complex process. There are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, the fluencies goes. So it will be reflecting in the form of stammering or stuttering. In Hindi we call it the haklana. Or I'll be talking now one by one with the different communication disorder. Let's talk about the like puberphonia or feminine voice. So in the puberphonia can be because during puberty, mass of the vocal cord, length of the vocal cord increases due to a hormone called testosterone. Okay. So before puberty, there is no much difference between boy or girl's vocal cord. But after puberty, because mass of the vocal cord has increased, length of the vocal cord has increased. So the vocal cord is, which was earlier like a thin string of the guitar, now it has become thick string. So thin string produces high pitch voice, if you remember the guitar, and thick string produces low pitch voice. So after puberty, what should be the voice? It should be low pitch. But the child has spoken from so many years, like high pitch voice from childhood to puberty. So because of the so many years habit, he will not accept the change which has happened during the puberty. So suppose this is the whole mass and the whole length of the vocal cord. So he will be vibrating only thin edges. Okay. So when he is vibrating thin edges of the vocal cord, then what does it mean that? Vocal cord which was actually thick string, now it's behaving like a thin string. And when the guitar string will be thin, the pitch will be higher. Is it not? You have seen the guitar now? Navraj?
Sir, asking me?
Yeah. So have you seen the guitar? In the guitar, there will be two strings. One will be thin and other will be thick. So thin string produces high pitch voice, shrill voice, and thick string produces more masculine, more low pitch voice. So before puberty, our vocal cord, in the case of boys, there is no much difference between boy and the girl's vocal cord. But after puberty, due to the hormone called testosterone, the mass of the vocal cord has increased, length of the vocal cord has increased. So the vocal cord which was actually thin string, now it has become thick string, and thick string should produce the low pitch voice. But from childhood to puberty, those who are having the puberphonia, they have spoken in a high pitch voice. So because of so many years habit, they will not accept the change which has happened during the puberty. So to maintain their childish voice, they will just vibrate the thin edges of the vocal cord, not whole mass and the whole length. So if you are vibrating only thin edges, so the vocal cord is actually the thick string, but behaving like a thin string. And thin string means high pitch voice. So this is basically the biophysics of the puberphonia. But high pitch voice can be due to the so many reasons. Like if nature has suppose not given the sufficient mass and the length of the vocal cord, we call it a sulcus vocalis. So in that case also the high pitch or feminine voice can be there. Suppose there is a muscle tension dysphonia because the pitch or frequency depend upon a formula. If you are from physics background, n is equal to 1 by 2 L under root T by M. So the frequency is directly proportional to the tension. So if tension in the vocal cord will be more, if you are talking, putting more stress and talking, so that time also the pitch will be higher. Okay. And there are cases phonatory gap. In that case also I have seen the high pitch voice. And in a rare case, I think just in my whole life I have got only one patient. there is a testosterone hormone issues. In that case also the pitch will be higher. So I can say that it's not like a high pitch voice is there and you take XYZ exercise. There should be proper evaluation. We should understand the problem, what could be the reason, and based on that the treatment should be started. That's why if you'll go to the healthcare quacks, because those healthcare quacks will usually go to some speech engineering clinic, or they will read something because of the employment, they will start giving some therapy and they will say that I'll charge less, I will do free of treatment. So in those cases, if they will proper diagnosis will not be there, then maybe you can damage the vocal cord because of some wrong vocal exercise, shouting, whispering. These are all kind of vocal abuse, and vocal abuse may damage the vocal cord sometime permanently also. So this was, I was talking about the high pitch voice, why the high pitch voice happens. So in the voice therapy, what we do, suppose in the case of Puberphonia, only thin edges of the vocal cords are vibrating, we stimulate whole mass and the whole length to vibrate in an effective manner. So the vocal cord which was behaving like a thin string earlier, once we'll stimulate whole mass and the whole length, so it will start like behaving like a thick string and the pitch will reduce. So that was your case. Okay, but there can be some other reason also for the high pitch voice. Suppose nature has not given sufficient mass and length. So if I'll be using this voice therapy technique, so maybe not be much effective. But if I'll work on the tension, so slightly we can reduce the pitch. So we have not seen very impressive result in the case of sulcus vocalis. And especially those people who are having the history of vocal abuse, taking self-treatment or taking treatment from the healthcare quacks. In that cases also we have found challenging to treat. And yeah, so I'll be just discussing the questions. Yeah. सो हिंदी में बोलने के लिए सजेस्ट कर रहे हैं, तो हमने हिंदी में इसके पहले वाला लाइव किया है, तो आज हम लोग इंग्लिश में कर रहे हैं, लेकिन हिंदी में भी किया था। ठीक है, मैं हिंदी में भी बताता हूँ। आज हम लोग थोड़ा सा बात करेंगे और बात कर रहे हैं स्पीच लैंग्वेज पैथोलॉजी प्रोफेशन के बारे में और स्पीच थेरेपी के बारे में. There are some questions related to people are asking in Hindi. So Naraz, don't get bored. Just I'll be speaking for my YouTube fans in Hindi. और इसमें हमारे जो क्लिनिक में जो ट्रीटमेंट होता है, पिच और लाउडनेस की प्रॉब्लम होती है, उसका हम लोग स्पीच थेरेपी देते हैं. और जो लोग अटक के बोलते हैं, हकलाते हैं, उसका हम लोग स्पीच थेरेपी देते हैं. किसी की वॉइस सडनली चली गई है, हम लोग बोलते हैं फंक्शनल एफोनिया, उसका भी हम लोग स्पीच थेरेपी देते हैं. और एक स्पीच थेरेपिस्ट और एक जो झोला छाप डॉक्टर, दोनों में अंतर समझना बहुत ज़रूरी है, क्योंकि सोशल मीडिया के ज़माने में झोला छाप लोग भी अपने आप को स्पीच थेरेपिस्ट लिख लेते हैं. तो ऐसे केसेस में अगर कई बार आपकी वॉइस और वोकल कॉर्ड डैमेज हो सकते हैं, तो जानिए जो लोग असली स्पीच थेरेपिस्ट होंगे वो बताएंगे कि उन्होंने पढ़ाई कहाँ से किया है, कौन सी ईयर में ग्रेजुएशन स्पीच लैंग्वेज पैथोलॉजी और ऑडियोलॉजी फील्ड में किया है, कौन से कॉलेज में पढ़ाई किया है, कौन सी यूनिवर्सिटी से डिग्री उनको मिला है. और तो ये सारे डिटेल बताएंगे. रिहेबिलिटेशन काउंसिल ऑफ इंडिया में रजिस्टर्ड है कि नहीं है, अगर रजिस्टर्ड है तो रजिस्ट्रेशन नंबर क्या है, तो वो सारे डिटेल भी अगर आप उनसे पूछेंगे तो वो बताने में हिचकेंगे नहीं. लेकिन ये अगर झोला छाप किस्म के जो लोग होंगे उनसे अगर पूछेंगे तो वो प्रॉपर आंसर नहीं देंगे. तो इससे आप पता कर सकते हैं कौन असली है और कौन नकली है. और मैं बात कर रहा था कि स्पीच प्रोडक्शन का मैकेनिज्म क्या है, तो इसके लिए जो है थोड़ा सा अगर मैं बताऊंगा तो उससे समझ में आएगी कि कौन सा कम्युनिकेशन डिसऑर्डर क्यों होता है. अगर हम बेसिक मैकेनिज्म अगर समझ लेते हैं तो स्पीच प्रोडक्शन के लिए जो पहला स्टेज है थॉट्स है, वो हमारे दिमाग में आता है. फिर हम सांस लेते हैं, फिर जब सांस छोड़ते हैं तो हवा का प्रेशर वोकल कॉर्ड्स के नीचे लगाते हैं. यहाँ पे लैरिंग्स है, लैरिंग्स के अंदर में 2 स्ट्रिंग की तरह के स्ट्रक्चर हैं जिसको हम लोग बोलते हैं वोकल कॉर्ड्स. तो जब उसके नीचे एयर प्रेशर लगाएंगे तो उसमें मूवमेंट शुरू हो जाता है और उस मूवमेंट से साउंड जनरेट होता है. फिर उस साउंड को हम लोग मॉडिफाई करते हैं डिफरेंट साउंड में अपने लिप्स, टंग, जॉ, टिथ, पैलेट के माध्यम से. जैसे अगर प बोलना है तो लिप्स एक दूसरे के पास आ रही है, त बोलना है तो टंग दांतों के बीच में आ रही है, क बोलना है तो बैक ऑफ द टंग एलिवेट हो रहा है. तो हर एक साउंड का एक अपना प्लेस है और अपना एक मैनर है. तो जब हम एक सेंटेंस बोलते हैं तो कई सारे प्रोसेस से गुजरना पड़ता है. थॉट्स आया, फिर हमने सांस लिया, हवा का प्रेशर वोकल कॉर्ड्स के नीचे लगा, वोकल कॉर्ड्स में मूवमेंट हुआ, साउंड जनरेट हुआ, उस साउंड को हमने मॉडिफाई किया अपने आर्टिकुलेटर्स के माध्यम से. फिर एक सेंटेंस में कई सारे वर्ड्स हैं, हर एक वर्ड्स में कई सारे साउंड है, हर एक साउंड का अपना एक प्लेस है, अपना एक मैनर है. जैसे प बोलना है तो लिप्स मूव हो रहा है, त बोलना है तो टंग दांतों के बीच में जा रहा है. तो कितना कुछ एक साथ हो रहा है. तो इस प्रोसेस में हमारे बॉडी के हंड्रेड्स ऑफ मसल्स एक साथ मिलकर काम कर रहे होते हैं। अगर उनके बीच का कोऑर्डिनेशन किसी भी रीजन से अफेक्टेड होता है तो स्पीच की फ्लुएंसी अफेक्टेड होती है। तो अगर कोऑर्डिनेशन नहीं होता है प्रॉपर, तो उसमें जो रिफ्लेक्ट होता है कम्युनिकेशन डिसऑर्डर, उसको हम लोग बोलते हैं स्टैमरिंग और हकलाने की समस्या हो जाती है। अगर प्लेस और मैनर में प्रॉब्लम होता है कि प्रॉपर वे में लिप्स, टंग, जॉ कहाँ पे कौन साउंड के लिए लगाना चाहिए वो नहीं लगाते हैं, तो उच्चारण की समस्या हो जाती है। और फिर जो है प्यूबर्टी के टाइम में जो चेंजेस होते हैं हमारे बॉडी में, हार्मोनल चेंजेस होते हैं मेल के केस में, टेस्टोस्टेरोन की वजह से, हार्मोन की वजह से वोकल कॉर्ड के मास और लेंथ इंक्रीज होते हैं, उससे पिच रिड्यूस हो जाता है। तो जो पतली आवाज़ थी बच्चों जैसी थी वो मोटी आवाज़ में कन्वर्ट हो जाती है। तो जो प्यूरफोनिया वाले पेशेंट होते हैं, पतली आवाज़ वाले पेशेंट होते हैं, प्यूबर्टी के टाइम में जो चेंज होता है वोकल कॉर्ड को इफेक्टिवली जो जो मोटी तार बन जाती है, तो वो पूरे अच्छे से वाइब्रेट नहीं करा पाते हैं। तो जब इफेक्टिवली वाइब्रेट नहीं कर रहा होता है तो वोकल कॉर्ड, जैसे सपोज ये है, तो वो थिन एजेस को वाइब्रेट कराते हैं। तो जो एक मोटी तार है वो पतली तार की तरह बिहेव करता है, तो ऐसे केसेस में पतली आवाज रह जाती है। तो एज ए वॉइस थेरेपिस्ट हम लोग क्या करते हैं कि होल मास, होल लेंथ को स्टिमुलेट कर देते हैं वोकल एक्सरसाइज के माध्यम से, जिसको हम लोग बोलते हैं वॉइस थेरेपी, और पिच रिड्यूस हो जाता है। और इसके अलावे मान लीजिए कई बार क्या होता है, कभी कभी इन्फेक्शन की वजह से, वायरल इन्फेक्शन की वजह से, बैक्टीरियल इन्फेक्शन, या कभी कभी सर्जरी के दौरान जो वोकल कॉर्ड्स जो हैं उसको सप्लाई करता है वेगस नर्व्स, टेक्निकली हम लोग बोलते हैं, उसका एक पार्ट होता है, मतलब रिकरेंट लैरिंजियल नर्व, वेगस नर्व का पार्ट होता है, वो सप्लाई करता है। कभी सर्जरी के दौरान कट हो गया या डैमेज हो गया तो फिर वोकल कॉर्ड पैरालाइज हो जाती है। तो उस केस में एकदम से जैसे बोलेंगे तो हवा निकल जाएगी और लाउडनेस नहीं रहेगी। तो अगर हमारे प्लेलिस्ट में वीडियो देखेंगे जो वोकल कॉर्ड्स पैरालिसिस वाले, तो उससे आपको आइडिया लग जाएगा। तो वैसे केसेस में भी जो है कम्युनिकेशन डिसऑर्डर हो जाता है। और तो ये रहा बेसिक चीज़ें हमने जो बताया। और डिलेड स्पीच लैंग्वेज बच्चों में पहचाना जा सकता है, जिस अवेयरनेस के लिए बताना चाहूँगा कि अगर आपका बच्चा 1 साल का हो गया है और पहला मीनिंगफुल वर्ड नहीं बोल रहा है, तो कुछ न कुछ गड़बड़ है, आपको स्पीच लैंग्वेज पैथोलॉजिस्ट या स्पीच थेरेपिस्ट से मिलना चाहिए। 2 साल का बच्चा हो गया है लेकिन दो दो वर्ड को जोड़ नहीं रहा है, फ्रेजेस में बात नहीं कर रहा है, तो कुछ न कुछ गड़बड़ है, आपको एक प्रोफेशनल से मिलना चाहिए, आपका या आपके घर में, आपके आसपास में अगर कोई ऐसा बच्चा है। 3 साल का अगर बच्चा हो गया है, उम्र 3 साल हो गया, अगर सेंटेंस में बात नहीं कर रहा है, तो कुछ न कुछ गड़बड़ है, आपको एक प्रोफेशनल से, स्पीच लैंग्वेज पैथोलॉजी से मिलना चाहिए और डिटेल इवोल्यूशन करके उसका रिहैबिलिटेशन स्टार्ट करना चाहिए। तो बेसिकली नवराज की जो आवाज़ थी वो पतली आवाज़ थी, हमने इनका थेरेपी दिया ऑनलाइन। और आज हम लोग थेरेपी के बाद लाइव हैं, हमने इनका प्री थेरेपी लाइव किया था 15 दिसंबर को 2020 को, वो ज़रूर आप लोग देखिए। नवराज हम लोग अब ये लाइव को स्टॉप करेंगे, 30 मिनट्स का हमारा प्लान था। तो एक बार अपनी आवाज़ को सुना दीजिए, जस्ट टेल अबाउट योर सेल्फ एंड योर प्रॉब्लम, बिकॉज नाउ वी आर गोइंग टू स्टॉप दिस लाइव वेरी सुन।
So
सो हाउ
my
डू
name
फील?
is, sir, I feel very happy, sir. So my name is Nauraj Chitri. I am from Bhutan and I am 18-year-old. In June I will be 19, so last time that's why I told 19-year-old. So after this therapy I am feeling lots of changes.
So what was exactly the problem before treatment? Can you describe?
Before treatment I had a female kind of voice, sir. So I
So
was
when you are
not able
calling to your friends and the relatives on the phone after the treatment, what is the reaction?
they are saying your voice has changed, sir.
So they are able to
Sometimes they are
recognize you?
no, sir. They are not able to recognize me, sir.
Okay, so now we'll stop this live. So let me thank everybody, those who have joined. Thank you, Vikram. Thank you, Niger. Thank you. Thank you, Senior. Thank you, Pawan, Kalyan. Thank you, everyone, for joining us. Thank you so much. And you can contact us if you want, you have communication disorder, or if your loved one is having communication disorder. Click our website www.speechtherapyindia.in. Click then reach me, and you'll find my email ID, my contact number, or you can reach physically also. And our contact number is 08042041980. If you are from India, if you are from outside India, the contact number is 918042041980. Thank you, everyone. Thank you. Thank you, everyone, for joining us. And thank you, Noraj, for being live and just helping to create awareness among
Thank you
the
so much,
society.
sir,
Thank you
for
so much.
helping me, sir.
Okay, thank you so much. So we'll stop this live now. Okay.
Yes, sir.